Every day. I'm Andrea. Every day, I'm Andrea Hill with Momentum Nonprofit Partners, and I'm the Chief Program Officer here. We are accompanied by a number of our staff who are on the call as well: Kevin Dean, Dorian Hines, Sherry Rout, and also April Carter. If you have any questions that you would like to share, if there is an opportunity, you can definitely drop those comments in our chat. But there will be opportunities for us to talk and engage about the data that we'll be talking about today within this session. Today, we are going to be talking about our 2023 State of the Mid-South Nonprofit Sector Report. This is our second iteration of this report. There is some interesting data, and there's also some interesting recommendations that we want to share with you today. So I will not take up too much of Dr. Nelson's time, and I'll allow her to introduce herself as well. But I'll turn it over to you. And again, just so everybody knows that we are recording this session. And so if you want to be on camera, you definitely can. Or if you would like to remain on camera off, that is perfectly fine. Please mute all of your mics for us, just to kind of eliminate some of that background noise. But again, we will have some opportunities for everyone to engage and interact with us throughout the presentation as well. We will be sending a copy of this PowerPoint, the recording, and a survey link at the end of this presentation. So again, if you have any questions or you'd like to review this again on your own, we will definitely share those resources with you, and we will also have them on our website and social media as well. So with all of those disclaimers out of the way, I'm going to turn it over to Erin Nelson. And Erin, let me pull up your screen for you as well.
Perfect. Are you also going to pull up the PowerPoint?
Yes.
Sweet. There we go. Okay. Well, good. It's still morning. So good morning, everyone. I am Dr. Erin Nelson. I am an associate professor of nonprofit management and the associate director for research and education with the Institute for Philanthropy and Nonprofit Leadership at the University of Memphis. And I am thrilled to once again be partnering on the State of the Sector report. I think this is really important research so that we all kind of get an understanding of what's going on in our field and our sector. We kind of have an idea of what's going on nationally, but it's really important to know what we're seeing locally and how that relates to what we do or do not see. So let's pop up the agenda. So I'm going to give an overview of the state of the sector. We basically, as I was going through the data, as I formed the survey, we looked at national trends and just kind of what we saw in the last iteration and came up with some focus areas. So I'm going to talk about those particular areas and what the data show there. And then also the implications and recommendations that we made based on what the data showed. And then at the end, we'll have time for Q&A and some talking, just so we can hear what your thoughts are, how these relate to what you're seeing in your organization, and any questions that we might have. So next slide, please. All right, so the big takeaway, if you want just like the quick overview, the findings of the report reveal a continued racial leadership gap, particularly at the executive organizational level. We see a reported increase in program and service demand, with many respondents indicating that their organizations really are struggling to meet those demands. We're seeing funding limitations and staffing challenges, which have a pretty direct impact on organizational capacity. And we're also, again, seeing a widely held indication that public policy feeling that public policy has a minimal to no effect on the organization and operations. And we're going to spend some time talking about that a little bit later too. Okay, so as far as organizational leadership is concerned, one of the more important and unfortunately not surprising things that we noticed is an overrepresentation of white people at all levels of leadership, which when we're thinking about Memphis and Shelby County in particular, and Memphis in particular, we know that we have 50% Black population in Shelby County and over 60% in Memphis. And about 90% of our respondents are located in Memphis. So there's clearly a disconnect and a disproportionate number of leaders of color that are being represented in executive levels of leadership. The majority of responding organizations have white CEOs. The majority of CEOs are women. But what we also saw is about a quarter of responding organizations only have CEOs who are women of color. And so that to me was particularly alarming, just given, you know, demographics broadly speaking, and how we would expect them to reflect the city. So as we saw in the 2020 report, most CEOs are relatively new in their current role, and most do intend to be in their role for less than 5 years. So we're, you know, seeing a lot of transition in and around the sector. Whether or not people actually leave when they say they're going to leave within 10 years or 5 years is another story entirely, but we do have a group of CEOs who are having planned to exit, or who were planning to exit at some point in time. 3/4 of our respondents had paid staff other than the CEO. And on average, about 47% of C-suite roles in responding organizations are occupied by people of color, 43% of senior level. And then as you go down the organizational chart, you see closer representation to what we see in just Memphis and Shelby County populations. But that is not, again, that it's kind of showing a barrier between those low or entry level and mid-level, and then the higher level or higher levels of the organizational chart. A little more than half of the board members from responding organizations are white. But what's really interesting to note is that there's a strong relationship between having a higher proportion of board members who are BIPOC leaders and having a CEO who is also a BIPOC leader. And also, if you have executive and board leadership who are people of color, you're more likely to have people of color at higher levels in your organizational chart. And so what we're seeing is, you know, people really fostering environments of diversity and inclusion when that is demonstrated as a priority at the top of the organizational chart. But again, there's clearly a disconnect between the demographics of a region and the demographics of organizational leadership. And again, what's more, there's a very clear racial leadership gap, which is probably also not especially surprising, but it's something that we need to collectively address and be aware of. Organizational capacity was the second kind of chunk of things going on, and that was really due to the fact that we saw so much happening because of COVID. And so we asked respondents about changes in demand for their programs and services, particularly given everything, gestures wildly, particularly given everything that has happened since 2020. And just to kind of remind everyone, the 2020 survey that we sent out actually happened before the world collapsed and exploded. So, you know, what we're seeing, or what we should be seeing, is kind of a bit of a reflection of what has happened as a result of COVID and all of those changes. And so what we saw was about 2/3 of respondents saying that they saw an increase in demand for their programs. Am I on the wrong one? I am on the wrong one. Nope. Oh, you know what? Could you back up one, Andrea? Thank you. Sorry. So about 2/3 of the respondents said that they saw an increased demand for their programs, with most seeing a moderate increase in demand. So an increase significantly is over 25% increase in demand, which is pretty substantial. And then the increase moderately is 10 to 25% increase in demand, which is still pretty big when you think about organizational capacity. What's interesting here is that these numbers are up slightly from 2020, but not actually significantly. So I think what we're seeing is just kind of a general upward trend of increased demand on our organization. What we did see, though, was that demand was mostly driven by changing needs and the services that are being provided in response to those needs. But 1/4 of our respondents said that they weren't able to respond to those changes in demand, with about 30% saying that they were maybe able to. So, you know, about half of our respondents are struggling to actually meet all of these demands that are placed on their organizations, whether sustained or new, given the changes in, well, since COVID. Over the next year, respondents noted that they are likely to add programs and services, increase the number of clients served, partner to expand programs and services. But what's really interesting is there's a fairly sizable relationship between those three. So if an organization intended to expand its scope, they're likely to partner in some way, shape, or form to do that. And that also creates a capacity challenge as well, because I think we all know that collaborating is a time and labor intensive undertaking. And so we've kind of in the recommendations piece got some things to say about that as well. Also, what was really interesting is size doesn't actually have any bearing on the data. Oh, can you back up one, Audrey? Yeah. Size has no bearing on the data. It's actually seen across the board, all organization types, all mission types. And again, these numbers really haven't changed from our 2020 report. So, or capacity to. There we go. So on the prior slide, there was a huge uptick in demand for programs and services, and respondents were planning to increase their portfolio even more. But the data also showed that it actually might be difficult for organizations to actually attain these goals, with major challenges in obtaining funding, and really having trouble finding enough staffing internally to get all this stuff done. And the two core capacity challenges really were funding and staffing, and obviously those two are going to be pretty fairly intertwined. Respondents said that general operating support continues to be a major challenge for the majority of respondents. And again, 61% saying it's a major challenge. So it was a major challenge, minor challenge, or no challenge. And only 11% said that it was no challenge for the organization. So, you know, we have 89% saying in some way, shape, or form, general operating support is not easily come by. Similarly, obtaining program-related funding was a major challenge for half of our respondents, and only 10% noted that it wasn't a challenge. So again, you've kind of got funding, generally speaking, as at least somewhat of a challenge for almost all of the respondents. And then finally, 66% of respondents said that they saw a moderate or significant increase in organizational expenses. But what was interesting is those interesting is not in the good way. The increased expenses were not met with an increase in revenues. Instead, only about half of those organizations saw increased revenues. The good news is the organizations who saw increased expenses largely also saw an increase in revenues. So it's not entirely lopsided, but it's also not a one-to-one. Like if you saw a 10% increase in revenues, you didn't also see a 10% increase in expenses. You didn't also see a 10% increase in revenues. So there's still lopsidedness there, but it's not that the people who saw such significant decreases in revenues also saw increases in expenses. So all that to say. So in terms of staffing then, ties directly into funding, right? The organizations report their ability to offer competitive salary and benefits are huge staffing challenges for organizations. And they translate to difficulty with recruitment and retention of staff. And many sector leaders are finding it difficult to have a fully staffed organization because they don't have the funding and resources to do it. And I think what we're seeing globally, not just in Memphis, is that being able to provide competitive salary and benefits is really difficult for nonprofit leaders, because we have, other sectors, other organizations who are able to provide competitive wages for their staff. About a third of our respondents said that they have major challenges with recruitment and retention of board and volunteers. So if we think about, okay, if funding is an issue and we're trying to offset some of that workload and changes in demand to our staff, maybe we can look to our unpaid volunteer workforce to kind of augment that a little bit. And they're not necessarily able to do that because they're not finding the workforce there to help kind of balance that out in terms of making sure you have a fully staffed organization. Not a surprise to anyone. I'm sure the organizations who have the most challenge with general operating support and funding have the most challenge finding an adequate staff or finding adequate staffing measures. They have the most challenges weathering changes in demand, and they have the most challenges in just general organizational capacity. And so, obviously funds matter. This is not news to anybody, I'm sure. One thing that is really interesting, though, is these changes in capacity have stayed consistent since 2020. So again, we're kind of looking at that more broad uptick of changes in demand, changes in organizational capacity kind of rising with it over time, not just as a result of COVID. So now, I just need to take a minute here for myself. So the policy and advocacy piece, we were shocked in 2020 because of the perceived lack of importance of policy in the sector on our organizations. And we came into this report thinking, oh, well, everything that's happened since 2020, hopefully, between that and the education that organizations here have been doing for the sector, maybe things have changed. However, a very high proportion of respondents said that policy at no level had any effect on their organizations, and that it actually increased across the board. So, looking a little bit more deeply at policy, these data will show, Andrea, can you advance it? The data will show the change in perception between 2020 and 23. So again, we would think because of 2020 and, COVID, George Floyd, just the seismic shift in our society and awareness of the role of policy on the sector and the people that we serve, that things would have improved, but instead they got worse, in some cases much worse. So there's a 10-ish, 15-ish% change between the organizations in 2020 and 2023 who thought that tax policy had any effect on their organization, a little bit of change in local policy, a little bit of change in state policy, and a little bit bigger change in federal policy. And what is interesting is over 40% of the respondents indicate that changes to public policy at any level has absolutely no effect on their organization. And so there's that chunk. And then the respondents who said that, you had a little effect or a lot of effect was between 60 to 70% of the respondents in themselves. And so there's really little perception among the respondents of the effects of public policy on the sector and on their organizations. And it's particularly troubling given the common misconceptions about the role of nonprofits in the policy process. And so I think one of the things that we need to remind ourselves is that public policy and nonprofit organizations are inextricably interconnected. The fact that the nonprofit sector exists was a product of tax policy, like the 501c3 status is a tax policy result. Our organizations exist to work to ameliorate challenges provided by policies and practices that have failed our clients or have created gaps in service provision to the community. And so because of these policy changes, we exist and provide services and provide programs. So understanding that our organizations are affected by policy and that it's kind of incumbent upon us to understand what those policies are and what role we play in that policy process is really important. So what does this all mean? The results the data provided the results, and they really pointed to a couple, or actually 4 things that nonprofits can start to think about. And the first is organizations need to constantly consider whether staffing and leadership and that staffing and leadership mix reflect the values that are espoused and enacted in the organization and the relative importance of equity within the organization. We have huge efforts towards DE&I, but if we're still seeing these gaps, racial gap, leadership gaps in our organizations, clearly something is amiss. And I know that it's easy to have DEI day or to have, an HR policy that says something about making sure you have equitable hiring practices, but you need to really start implementing them at the top of the organizational chart. And boards, that be you, boards really need to think about that a little bit more intentionally and have that translate down into the organization's culture and values. We need to build capacity around talent. Again, money helps lots of things, but with the current state of affairs, we need to actually really look at what's going on and address what we can, how we can. First and foremost, if there is a gigantic group of CEOs and leaders who are thinking about leaving their positions, we definitely need to start thinking about succession planning. We need to have succession plans either in formation or in place so that when we do have these shifts of leadership, we know what to do in our organizations. Hiring and firing people, we don't want to fire people, that's not good. But leadership transitions are expensive. both time and financially. And so if you have a succession plan in place, you have a better roadmap and some idea of what you're going to do rather than running around like, and so, get that done. But the other thing we can think about doing is taking advantage of low or no cost training and PD for staff and leadership. Momentum does a lot of things. There are a lot of other capacity builders around the city who can provide, especially subsector specific things, but make sure that you are taking advantage of those opportunities to develop your staff, because when you're thinking about retention, obviously you want to provide ways for them to grow in their leadership of the organization, but you can't necessarily give them a promotion. So how can you help them develop and how can you help retain staff? One of the ways is by giving them opportunities to grow in their current position. We also need to think about collaboration as a means of building capacity. We need to really carefully think about the costs and benefits of collaboration. I think it's known that there's a pretty substantial startup cost when we're thinking about relationship building. Just doing the vetting of things that we need to do to form a collaboration formally. But they are or can be a great way to start thinking about how to address larger systemic issues. They can be a great way to improve your organization's mission fulfillment, even given those startup costs. So having that as a priority, which I know a lot of you do, but having it as a priority as a way to kind of increase your organization's capacity is great. And then finally, please be an active participant in policy and advocacy work. The simplest way to really start doing this is to educate your board and key leadership about policies related to your mission. The boards that I serve on, I'm sure the boards that some of you serve on, have really good board development. And part of board development is, hey, here are some policies that are coming up, or here are some things that city council's thinking about, or here are some things that the state legislature is talking about. Excuse me. And here's how it would potentially affect our organization. And that way it's not policies bad, policies good. It's here is what the impact of public policy has on our organization. And so when your board and your executive leadership are aware of it, they can actually act on it. And that will help kind of create, again, that culture and instill that into, basically once you get more reps in, you'll start doing it more. And so that will be one of the ways you can do that. And I'll just put in a plug for Momentum. Once they're formalized as a state association, stay informed of what they're doing and how your organization can contribute to the conversation, because you will, it's incumbent upon your organizations and the clients that you serve to do that and to engage. And also it's just good to have a voice on the state level. Excuse me, goodness. So then we also wanted to let funders know what they can do. And the simplest thing to say is likely common sense for us, and that's just to continue or help increase multi-year general operating support. When organizations have sustained funding, they have more flexibility to keep up with all of these challenges and changes and increases in demand and staffing issues that we're seeing. And so, you're not writing a grant every 6 months or every year. You have a steady stream of multi-year funding where you have the flexibility to actually, be a little bit more nimble and not even responsive, but proactive. And point 2 relates quite closely to point 1. With sustained fundings, organizations can hire the people that they need to carry out their missions by offering competitive packages. We all want a good benefits package because at some point we or our kids or our loved ones are going to get sick and we need to go to the doctor, and that's expensive to do out of pocket. So, having a good salary and competitive benefits package is going to help get good talent into the sector. Plus, when we have talent capacity funding, we can set money aside for PD, we can set money aside for succession planning, we can set money aside to, find different ways to partner and within our organization and build and develop talent and keep people in our organizations, but more importantly in the sector. And then third, we know that collaboration is important. We also know that it's very expensive. It's a huge sunk startup cost. And so providing that financial support to organizations during these early phases, during relationship building, even helping establish, networking or helping organizations find partners to potentially collaborate with is really important. And it can relieve many of those barriers that are actually keeping organizations from collaborating. And then finally, engage or encourage engagement in policy. A lot of organizations are really reluctant to engage in policy because they fear funders pulling their support. They fear retaliation from not only philanthropy and foundations, but also just individual donors. And so when philanthropy encourages advocacy and lobbying, they're showing organizations that, or encouraging them to actually participate, showing organizations that it is a priority and should be a priority to look more systemically. And especially when you provide general operating support to fund, not necessarily, well, yeah, you provide general operating support to let the organization do its thing, one of which is advocacy and lobbying. That's actually going to go a long way to really help encourage and also provide some support to organizations who should and want to be engaging in policy.
And Erin, we had 2 hands that were raised while you were doing those 2 slides. We had one from Michelle. Michelle, if you want to unmute and ask your question, and then to Marvin.
Hi, yes, thank you. I actually have 2 questions, but I'll make them quick. Do you have a example of a successful collaboration? Because I'm just not, in my mind, I'm not coming up with how that works. And then my second question is around the public policy, and this might be for Andrea. Does Momentum or another organization keep nonprofits up to date on the various public policy issues that are happening locally and at the state level that we can access? So 2 different questions, but that's all I had. Thank you.
So Erin, do you want to answer that first one first, and then I'll do the second one?
Sure. So collaboration is a spectrum. It can be, just one-off. We're going to do a quick project here, partnerships. It can be end in a merger. And so, they're locally, quite honestly, what Momentum's doing with the state association will be an important collaboration, because if you are, and really even Momentum now is a collaboration, because you're working as kind of an umbrella organization, bringing organizations together to build capacity. That in itself is a collaborative effort, because you're not just looking at individual organizational capacity, you're looking at broader, like, sectoral capacity. Community Alliance for the Homeless, brings together organizations that kind of focus on those various mission areas. There are actually a lot of umbrella infrastructure organizations that do that bring organizations together to work a little bit more intentionally through those processes. But one-off collaborations, it's difficult. I'll stop there and the question open if it needs to.
And Michelle, and so with Momentum, we have done a lot of work to make sure that we have a robust network of nonprofits that you can partner with on any number of opportunities, any number of events and different things that you have going on. One of the areas that I would say is kind of closely related to maybe with policy that you may be thinking about, we did our Bluff City Day on the Hill earlier this year. And so that was an opportunity for, I think it was 40 different individuals from about 16 to 20 different organizations. And we all came together to go advocate for individual missions, but then overall for the nonprofit sector. So there were things that we were looking at as far as maybe the Charitable Act or the volunteer driving tax credit act. So different things that we were looking to kind of galvanize around together. We were able to do that. And many of those organizations, some were education focused organizations, some were maybe senior or immigrant serving organizations. And so they worked together to kind of address maybe that senator or that representative that they wanted to talk to. So it was stronger together than opposed to these individual organizations going in and having those conversations. So that's one example. The other piece that, as Erin alluded to, as we explore going and becoming a statewide association, we have brought on Sherry Ralph, who's on our call today, as our Director of Governmental Relations and Public Policy. And in her role, she will be putting together really, like we were saying, this tracker of the policies that are legislations that are going through our Tennessee State Assembly or even federally. And so you'll have a chance to look at those things, but even through our Public Policy Action Network, you'll have the opportunity to have conversations around what are the implications for this? What are ways that we can help maybe address and talk about what are some of the harmful or even the positives around different legislation? And then having again another opportunity on February 27th and 28th to go to the state capitol again to do something similar to what we did with Bluff City Day on the Hill. So there are multiple opportunities through us to galvanize together around public policy that for us will support and mobilize the nonprofit sector. But then there are also individual ways that you can connect as well. And then just overall with Momentum, we do provide capacity building workshops. So around governance, around board management, around finance, and those other things that many organizations may struggle with or have some gaps in their capacity. And when you come to those workshops, you have the opportunity to interact and engage with others who are maybe going through something similar, and then maybe working through a plan of action together. So there's multiple ways that this can be done. And we have Dorian Hines, who is on the call as well, who is our partner services manager. And so he'll be able to kind of lead you through maybe navigating what is the best first step as a member or as a partner with Momentum.
And I'll also throw in a quick plug for, I think it's the CEO news blast that comes through from
Yes.
Kevin. He does a really good job of outlining policy things
Mhm.
that are either at the state level, the national level, or the local level. So, you know, I know we get 6 billion emails a day, most of which are inviting us to make sure that our boat insurance is still up to date. But that is one to keep kind of at the forefront and prioritize, because it does have a lot of really good sector level information.
And Marvin, we'll go to you, and then we'll go back to Erin's presentation, and I'm sure we'll have many more questions as well coming through.
Sure. Well, thank you so much, and thank you, Erin, and thank you, Momentum Nonprofit Partners, for queuing up such an important discussion. You know, Erin, as you were talking about, you know, why do nonprofits consider advocacy not a factor or something? And I just kind of searched back to my own work history, and I thought about the time when I was at Church Health for about 13 years, and I think a lot of nonprofits, part of their messaging, certainly Church Health's messaging, was healthcare is broken, and embedded in that message was, and government's not going to come and solve it, right? So it's incumbent on people of faith to respond to the needs of the poor in our midst, et cetera. And so that was kind of like a major plank of how we raised our money. And our donor base was of all different political persuasions. So there was I don't think anybody said this out loud, but there was a kind of a reluctance to go too far into healthcare policy advocacy. Now, that all changed when the Affordable Care Act happened, and all of a sudden our donors said, will there be anything left for the Church Health Center to do? And that, of course, missed the fact that it would take years to implement, and that people being uninsured would still persist even after full implementation. So we had to kind of, all of a sudden, we had a huge challenge on our hands. And I just wonder if any of your research got into the messaging aspect of the way nonprofits work, because I feel like, you know, there's even a delineation between 501c3 and a 501c4, right? I mean, one is built for specifically advocacy. So when people don't know where that line is, they worry about, and I've kind of gotten into the weeds in the civic part of my life, advocating for the Mid-South Coliseum as to what we can advocate for and exactly how. But I think if people don't understand where that line is, they'd kind of rather err on the side of not getting anywhere close to it. I just wondered if you'd kind of given any thought to messaging. Thank you.
Messaging in terms of like what an organization's perceptions are, or messaging in terms of what an organization could provide as messaging to?
If so much, I guess in the Church Health example, so much is built on, we have to take the we have to affect the outcome because help's not coming. So therefore, it almost like over time, and the dysfunction in government, both national and at the state level, kind of leads you to believe, gosh, that's a circus. Like even if you wanted to dedicate the time to trying to affect it, could you? And would it be just kind of time wasted? I think especially with the downsizing and with the pressures on staffing, so many people just see it as something they can't quite take a swing at because they're trying to do things that are more primary.
Mhm.
I don't
know. So a couple of things. I like preambles. So to be super nerdy, but I think it's kind of an important point that you're making. One of the reasons people think, academics think that the nonprofit sector exists is because of what we call failure theories. So there are certain things that the governmental sector and the private sector can or won't do because they're not going to make money off of it, because they can't do it effectively, or because of the political implications of doing whatever it is. And so that in a large way is where the sector comes in. And healthcare, like you said, is kind of one of those places. And it's funny that you mentioned the Affordable Care Act too, because one of my standby examples of policy affecting the sector, I was in Kansas City at that time. And I worked with what was then the Kansas City Free Health Clinic, and they actually had to go through their mission statement and adjust it because of the Affordable Care Act and make sure, and I think they changed their name too, because of the implications of policy on their organization and the mission. So it will affect you in some way, shape, or form, some more bigly than others, but it will have an effect
sure.
on it will have an effect on your organizations. In terms of messaging, so that you're right, there is a very fine line between what we think we can do and what we can actually do, and we don't want to step because we don't want to lose our status. But when we think about, number one, Sherry, I think would be a great resource for the sector period, because I think, having that experience, you'll be able to speak to that much more, but organizations can lobby. It's just a matter of understanding what the limitations are. There's a percentage of your budget that you can dedicate towards it. But having volunteers go and educate people about who you are and what you do and why you exist at any level, state, local, federal, isn't a bad thing. And in that case, you're just providing education about your organization and what you do and how your clients are affected by policy. So the messaging there, I would think would be, number one, to your board and key volunteers, what is it that these individuals who are committed to our organization, what can they do to help promote, market, advertise? Those are somewhat more friendly words. Educate these individuals and these groups about our organization, our mission, and our clients. But also, figuring out what the levers are and who might be more important to talk to for particular policy changes.
And Erin, oh,
go ahead.
You want to say, and Erin, I'll add, what Momentum is also doing, we'll be facilitating a few advocating and lobbying workshops to really give you more information, give organizations more information to help hopefully build that advocacy and lobbying muscle, and telling them the what you can and what you can't do, giving the who, what, whens, and wheres of all of that, and specifically on that lobbying day or that advocacy day that we're going to have on February 27th. It'll be a full day of how to talk to your legislators, what legislation is out there, giving them kind of the overview of it, and then helping them have that open opportunity or open access to those legislators on that particular day. But to your point, I do agree that that communication piece is important, and it is, I'll say it's a struggle, because many organizations are wondering, is it something that I can do? And the answer is yes, but to what degree? And what can I say? What can I say? What are those different things? And we also have Adam Nickus on the call, who joined us for our Bluff City Day on the Hill last year and did facilitate some communicating with legislators, workshops for us. And again, alongside Shared Route, we'll do our best, and we hope that others in this group as well will kind of bring out what are some best practices and share those during our Public Policy Action Network meetings too. We want to make sure that we are preparing, we're providing enough information that everyone feels comfortable or feels at least well prepared, enough prepared to be able to go and advocate. And really, to Erin's point, advocacy is basically talking about your mission. Why is it important? So at the very simplest piece, who are you serving and why are you serving them? Or what is the population that you're serving and why are you serving them? And why is it important for me as a citizen or as a legislator to know that? And then how can I help? So I think the next piece of that, and what we'll be doing some workshops on, again, shameless plug for Momentum, is that next piece. What is the ask when you speak with a legislator, and what does that mean? And what is the benefit to the whole community when we make those asks, and we're hoping that we see some success from that.
Yeah. And to follow up with that, just this morning, I think there was an organization locally in the news that had a successful advocacy plan and had some policy change. Actually, no. They got funding because they were working with Representative Cohen's office. And so, it's not just what you're doing is wrong, what you're doing is bad, what you're doing is hurting. It's more, hey, can we get some money? Because what we're doing is kind of awesome, which also is a little bit friendlier to say sometimes.
Mhm.
All right. Well, Erin, I know you
Thank
have.
you, Erin.
Yeah.
I know you have maybe 1 or 2 more slides, but if anyone has any questions or any comments, please drop those in the chat for us. And also, again, we're going to probably in about less than 5 minutes, we're going to allow people to come off mute again and then ask any of those questions about the data or just public policy and this conversation in general.
I was actually done. So if we
here we go. Look, saving folks the time. So does anybody else have any questions? And thank you, Marvin and Michelle, for y'all's questions as well. We do have one comment in the chat that I can, let me see if I can. It says, additionally, there are some groups who are very engaged in advocacy. There are a quite progressive side of the spectrum, but nonprofits can choose to engage with the issue they are campaigning for. And some examples people are giving are Stand for Children, Memphis for All, De-Incarcerate Memphis, I think I said that right, and Micah. But there are many other organizations as well that are out there. More from Memphis is doing some work as well. So if anyone has any questions or any thoughts, please unmute and share. And we have a few more minutes until the end of our session.
I would also be interested to hear what you all think is what was most interesting to you, what seems frightening and also